Liver health, prevention and monitoring cirrhosis and liver cancer. The liver cancer is a serious and potentially life-threatening disease with a variety of causes that are difficult to control and treat. Among the many causes, chronic infection with hepatitis B virus, HBV, and hepatitis C virus, HCV, are important risk factors. Understanding the link between these viral infections and liver cancer is critical for prevention, early detection, and effective treatment. Hepatitis B is a major global health problem, with more than 250 million people worldwide living with chronic HBV infection. The virus is primarily transmitted through contact with infectious body fluids, such as blood, semen, and vaginal secretions. Vertical transmission from mother to child during delivery is also a common route, especially in endemic areas. Chronic HBV infection significantly increases the risk of hepatocellular carcinoma, HCC, the most common type of primary liver cancer. The pathogenesis of HBV-related HCC is multifactorial and involves direct effects of the virus on hepatocytes, as well as chronic inflammation and liver fibrosis. The risk of liver cancer in HBV-infected individuals is further exacerbated by cofactors such as alcohol consumption, co-infection with HCV or HIV, and cirrhosis. Even in the absence of cirrhosis, people with HBV infection have a higher risk of developing liver cancer than the general population. Hepatitis C virus, HCV, is another major cause of liver cancer, with an estimated 58 million people infected worldwide. HCV is primarily transmitted through blood-to-blood contact, with intravenous drug use being the most common route of transmission in many parts of the world. Unlike HBV, there is currently no vaccine for HCV, although direct-acting antiviral DAA therapy has revolutionized treatment, with cure rates exceeding 95%. Chronic HCV infection leads to liver inflammation, fibrosis, and ultimately cirrhosis, a key risk factor for HCC. The progression from chronic HCV infection to HCC typically takes decades, although factors such as alcohol consumption, HIV co-infection, and metabolic diseases such as diabetes can accelerate this process. The specific mechanisms by which HCV leads to the development of HCC are complex and involve both direct effects of the virus and indirect consequences of chronic inflammation and liver damage. HCV infection promotes the production of reactive oxygen species, ROS, which lead to oxidative stress and DNA damage. Furthermore, the chronic inflammatory environment in the HCV-infected liver can lead to activation of oncogenic signaling pathways, further increasing the risk of malignant transformation. Given the strong association between chronic hepatitis B and C infection and HCC, regular monitoring of liver health is essential for high-risk individuals. This is especially true for people who have been treated for HCV, as the risk of HCC remains high even after the virus is cleared. Current guidelines recommend routine liver ultrasound every 6 months for patients with chronic HBV or HCV infection and cirrhosis of any cause. In some cases, other imaging modalities such as CT or MRI may be used, particularly when ultrasound detects abnormalities. In addition to imaging, liver function blood tests and tumor markers such as alpha-fetoprotein can provide valuable information about liver health and HCC risk. Chronic liver disease, including non-alcoholic fatty liver disease, alcoholic liver disease, and autoimmune liver disease, significantly increase the risk of cirrhosis and HCC. Non-alcoholic fatty liver disease is becoming an increasingly common cause of liver cancer due to the increasing prevalence of obesity and metabolic syndrome worldwide. Men are at higher risk for liver cancer than women. This gender difference is particularly pronounced in older men, who are more likely to have chronic liver disease, alcohol consumption, and exposure to risk factors such as HBV and HCV. A family history of liver cancer is an important risk factor for the disease, especially for individuals who also have other risk factors. Early diagnosis of liver cancer and cirrhosis is essential for effective management and improved patient outcomes. Several diagnostic tools are available for detecting and monitoring liver disease, each with its own advantages and limitations. Ultrasound is widely recommended as the primary imaging modality for liver examination, especially for monitoring high-risk individuals. It is a non-invasive, widely available, and cost-effective tool that can visualize liver architecture and detect focal lesions. Ultrasound is particularly useful for identifying liver masses, assessing liver size, and detecting signs of cirrhosis, such as nodules and increased echogenicity. For liver cancer surveillance, ultrasound is typically performed every 6 months in high-risk individuals. However, ultrasound may have limited sensitivity for detecting small liver tumors, especially in patients with obesity or advanced cirrhosis. In such cases, supplemental imaging modalities may be necessary. FibroScan or transient elastography is an innovative and effective tool for assessing liver stiffness, which correlates with the extent of liver fibrosis and cirrhosis. This non-invasive technique measures the shear wave velocity generated by the mechanical pulse, with stiffer liver tissue generating faster shear wave velocities. FibroScan is particularly useful for monitoring the progression of chronic liver disease in patients and helps identify those who are at higher risk for developing cirrhosis and its complications. While it is not a direct imaging tool to detect liver tumors, its ability to assess liver stiffness provides valuable information that can guide further diagnostic and treatment decisions. Preventing liver disease and its progression to cirrhosis and liver cancer requires a multifaceted approach that includes lifestyle changes, vaccinations, regular monitoring, and appropriate medical interventions. Diet plays a vital role in liver health, and dietary modifications can significantly reduce the risk of liver disease. Eating more fruits, vegetables, whole grains, and lean protein while reducing saturated fats, sugars, and processed foods is recommended to prevent non-alcoholic fatty liver disease and other liver diseases. The Mediterranean diet is particularly protective against liver disease because it is rich in antioxidants, healthy fats, and anti-inflammatory nutrients. It is also wise to reduce your intake of red and processed meats, as they can increase your risk of liver cancer. In addition, limiting your intake of sugary drinks and high-calorie snacks can help prevent obesity, which is a major risk factor for liver disease. Limiting alcohol intake is one of the most effective ways to prevent alcoholic liver disease and reduce your risk of liver cancer. For drinkers, moderation is key. People with chronic liver disease or a history of liver disease should avoid alcohol altogether. Regular physical activity, such as aerobic exercise and resistance training, helps achieve and maintain a healthy weight. Exercise has other benefits for liver health, including improved insulin sensitivity and reduced inflammation. The above content only represents my personal opinion and is for reference only. Thank you very much for watching and listening.